I'm first and foremost a cancer surgeon, having started my professional life as a dentist and then as a doctor before training to be a surgeon. And most of this was done in London, where I grew up. I moved to Australia 20 years ago, where I now live with my 2 daughters and run my surgical practice, looking after patients with predominantly bowel-related conditions. A significant part of this involves patients with cancer, a disease that I've always had a keen interest in. And in fact, during my training, I did 2 years of laboratory research into some of the immune mechanisms within cancers. And this led to a thesis and a master's degree in surgery. So I consider that I have a good understanding of how this disease works. The traditional medical training is all about treating patients reactively and not proactively. But every time I've done an operation on a patient with bowel cancer, for instance, I've always thought to myself, how could this have been prevented? Recently, I've turned my attention to precisely this. And in the process, I've looked at ways of refining my own body, both physically and mentally. And whilst I've never been overweight, I've certainly made some improvements such that I'm now at my biological optimum weight, or BOW, a concept that Nestea has developed based upon what you can achieve if you follow our advice. Because I'm now at my BOW, my body is functioning optimally, and I believe that from an evolutionary perspective, I have the best chance of surviving and living to a ripe old age. I've always considered cardiovascular exercise to be important, and for many years my daily routine has been a 5-kilometre run or 20-kilometre bike ride first thing in the morning. And staying both physically and mentally fit allows me to pursue my passions, such as sailing and skiing and keeping up with my 2 daughters, and of course surgery, which is the best job in the world. I've also given a lot of thought to the food that I eat, and I've made some subtle changes based upon relearning and re-examining the huge number of biological processes and chemical reactions that are constantly occurring in the human body, particularly in relation to the food we put into our bodies. So we put together the Nestea formula, which is 3 things: intermittent fasting, cardiovascular exercise, and Mediterranean type cuisine, with a big emphasis on reducing refined carbohydrate. I am passionate about health, and it is a constant source of disappointment to see so many patients who are not looking after themselves because they haven't been given the right information. As a consequence, I'm seeing more and more diseases and illnesses that are exacerbated by obesity, such as cancer, heart attacks and strokes, diabetes, osteoarthritis and Alzheimer's. I've promised myself that I will dedicate the rest of my professional career to helping prevent these diseases by educating people as to what causes obesity and how they can both prevent and cure it. In addition to my surgical practice, I have a web design company, and using my knowledge, experience and my own daily routine, I've put together with John Aronis, my good friend and business partner, Nestea and its practical application, the Nestea formula. I know I can't change the world, I just want to leave it knowing I've done my best in trying to turn around this impending disaster we are facing, and I'm forever hopeful that Nestea's contribution will do just that.